NCSB NCLEX RN sample questions with answers full practice. Question 1. A client diagnosed with tuberculosis is prescribed rifampin and isoniazid. Which information should the nurse include when reinforcing information about these medications? Option A. You may have occasional problems sleeping. Option B. You can take the medication with food. Option C. You may notice an orange-red color to your urine. Option D. You may experience an increase in appetite. The correct answer is option C. You may notice an orange-red color to your urine. 3. Question 2. The nurse is reinforcing medication interactions with a client who is taking warfarin. Which over-the-counter, OTC, medication should the nurse remind the client to avoid? Option A. Naproxen. Option B. Diphenhydramine. Option C. Acetaminophen. Option D. Pantoprazole. The correct answer is option A. Naproxen. 1. Naproxen can prolong bleeding time and should therefore be avoided by clients who take anticoagulants. Question 3. The nurse is preparing to administer an antibiotic intramuscularly, IM, to a 2-year-old child. The total volume of the injection is 2 ml. What is the best approach for the nurse to take when administering this medication? Option A. Call the provider and request a smaller dose. Option B. Split the medication into 2 separate injections. Option C. Substitute an oral form of the medication. Option D. Inject the medication in the deltoid muscle. The correct answer is option B. Split the medication into 2 separate injections. 2. Question 4. The nurse is reinforcing teaching for a client with chronic kidney disease about the prescribed aluminum hydroxide. Which is the best statement by the nurse about this medication? Option A. It reduces potassium levels. Option B. It increases urine output. Option C. It controls stomach acid secretions. Option D. It decreases phosphate levels. The correct answer is option D. It decreases phosphate levels. For phosphates tend to accumulate in the client with chronic kidney disease due to decreased filtration capacity of the kidneys. Antacids that contain aluminum such as aluminum hydroxide, Amphigel, are commonly used to lower phosphate levels. Question 5. A client has a new prescription for sertraline, a selective serotonin reuptake inhibitor, SSRI, antidepressant. After reviewing the client's medical record, which data is the nurse most concerned about? Option A. History of an eating disorder. Option B. Current prescription for phenelzyne. Option C. History of premenstrual dysphoric disorder. Option D. Current prescription for alprazolam. The correct answer is option B. Current prescription for phenelzyne. 2-phenelzyne is a monoamine oxidase inhibitor, MAOI, antidepressant. Combining MAOIs with SSRIs and other serotonergic drugs poses a risk of serotonin syndrome. Question 6. The client is discharged from the hospital with a new prescription for furosemide. During a follow-up visit 1 week later, the nurse notes the following findings. Which finding is most important to report to the healthcare provider? Option A. Increased urine production. Option B. Occasional lightheadedness. Option C. Muscle cramps. Option D. Constipation. The correct answer is option C. Muscle cramps. 3. Furosemide is a loop, potassium-wasting, diuretic. It can cause dehydration and hypokalemia, which can result in muscle cramps. This is the most important finding. Question 7. The nurse is reviewing prescribed medications with a client. Which information should the nurse reinforce about captopril? Option A. Avoid using salt substitutes. Option B. Avoid green leafy vegetables. Option C. Restrict fluids to 1000 ml/day. Option D. Take the medication with meals. The correct answer is option A. Avoid using salt substitutes. 1. Captopril is an angiotensin-converting enzyme, ACE, inhibitor. It reduces aldosterone secretion, thereby reducing sodium and water retention. Captopril is used to treat hypertension and heart failure. Because it can cause an accumulation of serum potassium, i.e., hyperkalemia, clients should avoid the use of salt substitutes, which often contain potassium instead of sodium chloride. Question 8. A nurse administers cimetidine to a 75-year-old client diagnosed with a gastric ulcer. The nurse should monitor the client for which adverse reaction? Option A. Hearing loss. Option B. Mental status change. Option C. Constipation. Option D. Increased liver enzymes. The correct answer is option B. Mental status change. 2. Cimetidine is a histamine H2 receptor antagonist used to treat gastric ulcers. It has been found to cause confusion in susceptible clients, such as the elderly and debilitated clients. Clients over age 50 or who are severely ill may become temporarily confused while taking H2 blockers, especially cimetidine. Question 9. A client at risk for a stroke has been prescribed clopidogrel. Which information is most important for the nurse to reinforce with the client? Option A. You must take the medication on an empty stomach. Option B. If you miss a dose, take a double dose the next day. Option C. You must have your lab tests checked weekly. Option D. You must stop the medication a week before your surgery. The correct answer is option D. You must stop the medication a week before your surgery. For clopidogrel is an oral antiplatelet drug with similar effects to aspirin. The drug is taken for secondary prevention of myocardial infarction, ischemic stroke and other vascular events. Clopidogrel prevents platelet aggregation. Like all other antiplatelet drugs, clopidogrel poses a risk of serious bleeding. Clopidogrel should be discontinued 5 to 7 days before elective surgery. Question 10. The nurse is reinforcing the correct use of a metered dose inhaler, MDI, for a client newly diagnosed with asthma. The client asks, "How will I know the canister is empty?" What is the best response by the nurse? Option A. Drop the canister in water to observe if it floats. Option B. Contact your pharmacy to find out when to obtain a refill. Option C. Count the number of doses as the inhaler is used. Option D. Shake the canister and listen for any fluid movement. The correct answer is option C. Count the number of doses as the inhaler is used. 3. Question 11. A client is prescribed furosemide and digoxin for heart failure. The nurse should monitor the client for which potential adverse drug effect. Option A. Pulmonary hypertension. Option B. Acute arterial occlusion. Option C. Cardiac dysrhythmias. Option D. Acute kidney injury. The correct answer is option C. Cardiac dysrhythmias. 3-digoxin is a cardiac glycoside, or positive inotrope that increases myocardial contractility. By increasing contractile force, digoxin can increase cardiac output in clients with heart failure, HF. Furosemide is a potassium-wasting, loop, diuretic, prescribed to prevent fluid overload in clients with HF. Clients who take furosemide are at risk for developing hypokalemia. Potassium ions compete with digoxin and a low potassium level can cause digoxin toxicity, leading to lethal cardiac dysrhythmias. Therefore, it is imperative that potassium levels be kept within normal range, 3.5 to 5 milliequivalent/L, while taking digoxin. Question 12. The nurse in an ambulatory clinic is speaking with the parents of a 2-year-old child diagnosed with acute otitis media. Which information is most important for the nurse to include in the instructions to the parents? Option A. The child must complete the entire course of the prescribed antibiotic. Option B. The child may be given a decongestant to relieve pressure on the tympanic membrane. Option C. The child should return to the clinic to evaluate effectiveness of the treatment. Option D. The child may be given acetaminophen or ibuprofen drops for pain. The correct answer is option A. The child must complete the entire course of the prescribed antibiotic. 1. Question 13. The nurse is reinforcing teaching about levothyroxine for a client newly diagnosed with hypothyroidism. Which information should the nurse make sure to reinforce about this medication? Option A. The medication may decrease the client's energy level. Option B. The medication will decrease the client's heart rate. Option C. The medication should be taken in the morning. Option D. The medication must be stored in a dark container. The correct answer is option C. The medication should be taken in the morning. 3. A thyroid supplement, such as levothyroxine, should be taken on an empty stomach in the morning. Morning dosing minimizes the side effect of insomnia and an empty stomach facilitates absorption. Levothyroxine will cause an increase in the client's energy level and heart rate. Question 14. A client received hydromorphone orally 1 hour ago. When the nurse enters the client's room, the client is unresponsive to verbal stimuli and has a respiratory rate of 6. Which action should the nurse take next? Option A. Prepare for endotracheal intubation. Option B. Administer supplemental oxygen. Option C. Begin cardiopulmonary resuscitation. Option D. Prepare to administer naloxone. The correct answer is option D. Prepare to administer naloxone. 4. Question 15. A nurse is caring for a client who was recently admitted following an episode of status epilepticus. Which of the following data is most important to collect? Option A. Level of consciousness, LOC. Option B. Amount of intravenous fluid infused. Option C, pulse and blood pressure. Option D, injuries to the extremities. The correct answer is option A, level of consciousness, lock. 1. Question 16. The nurse is preparing a client for an intravenous pyelogram, IVP, test. What information is most important for the nurse to obtain prior to the procedure? Option A, time of the client's last meal. Option B, history of allergies. Option C, amount of urine output. Option D, BUN and creatinine level. The correct answer is option B, history of allergies. 2. Question 17. An older adult client, diagnosed with active pulmonary tuberculosis, has difficulty in coughing up secretions for a sputum specimen. Which nursing intervention would be most helpful for this client? Option A, encourage client to ambulate frequently. Option B, spray the oropharynx with saline. Option C, administer a nebulizer treatment. Option D, push fluids for the next 8 hours. The correct answer is option C, administer a nebulizer treatment. 3.